Avoid ginger if you have these health problems. While many of us love adding ginger to our meals or sipping it in teas, especially when we're feeling under the weather, some health conditions warrant caution before indulging in this otherwise healthy herb. In this article, we will explore which specific health issues may require you to limit or avoid ginger.
Welcome to Health Boars, please. If this is your first time here, like this video, subscribe and turn on the notification bell for more videos.
Key takeaways: ginger acts as a natural blood thinner and can disrupt normal clotting, which is risky for people with bleeding disorders or who are on medications like aspirin or warfarin. Those managing diabetes should be careful with ginger, since it can cause unexpected drops in blood sugar levels, making it harder to control the condition. If you have gallbladder issues like gallstones, consuming ginger may worsen your symptoms because it stimulates bile production. Individuals with heart conditions must use caution when taking ginger, as it can increase heart rate and interfere with cardiac medications. Before any surgery, stop using ginger due to its blood-thinning effect that could pose risks during medical operations. Bleeding disorders: ginger can pose risks for people with bleeding disorders due to its natural blood-thinning properties. These characteristics stem from the active compounds in ginger, which have significant antiplatelet and anticoagulant effects. Such influences are particularly critical as they can disrupt the normal clotting process of the body. As a result, individuals may experience excessive or prolonged bleeding episodes, a serious complication for anyone with hemophilia or other similar conditions. Consulting healthcare providers before adding ginger to your diet is essential if you have any blood disorders. Your doctor will have comprehensive knowledge about how ginger might interact with your condition or any blood-thinning medications like aspirin, clopidogrel and warfarin, Coumadin, that you might be taking. Diabetes: moving from concerns about bleeding disorders, diabetics must also exercise caution with ginger. This root can cause blood sugar levels to drop unexpectedly, leading to symptoms such as dizziness, weakness, and even fainting if not monitored properly. It's important for individuals on diabetes medication or managing their condition through diet to consult healthcare professionals before adding substantial amounts of ginger to their regime, because ginger stimulates digestive enzymes and can affect stomach function. Those who have diabetes could find managing their blood sugar levels more challenging after consuming high doses of this potent herb. Gallbladder issues: gallbladder problems can become more painful if you consume ginger. This root, despite its health benefits, stimulates bile production, which might not be ideal for people with gallbladder conditions. Suffering from discomfort or a worsening of symptoms can be a direct result of this increased bile flow. For those with gallbladder issues, the blood-thinning effects of ginger also increase the risk of bleeding complications. It's essential to talk with your healthcare provider before making ginger a part of your diet. They may suggest other remedies like chamomile or peppermint tea that are gentler on the digestive system and won't exacerbate gallbladder complaints. Heart conditions: while ginger can help with various ailments, its effects on the heart need careful consideration. People with heart conditions should be particularly cautious, as ginger's blood flow stimulation properties could lead to an increased heart rate. This might worsen existing heart problems, and is something to be mindful of for those managing hypertension or other cardiac issues. Furthermore, ginger's blood-thinning characteristics can pose a risk if you're taking medications like antiplatelet drugs. It may enhance their effects, potentially leading to excessive bleeding or bruising. Those currently on treatment for heart-related concerns must consult with their healthcare provider before adding ginger to their routine. Risks and interactions with medications: understanding the potential risks and interactions between ginger and certain medications is essential, as it can affect how your body responds to treatments for conditions like heart disease or diabetes. Read on to learn why consulting with a healthcare professional is vital before incorporating ginger into your health regimen. Blood clotting medication: ginger's ability to thin the blood can pose a serious risk for those taking medications meant to prevent clotting. If you're on drugs like warfarin or aspirin, carefully watching your ginger consumption is crucial. Even a small amount of this root could potentially amplify the effects of your medication and lead to increased bleeding chances. Medicines designed to keep blood clots from forming work diligently in your body, so adding ginger into the mix might upset that balance. Consult with your healthcare provider about how much, if any, ginger you can safely incorporate into your diet to maintain both the benefits of your prescribed medication and any dangerous side effects. High blood pressure or diabetes medication. Shifting our focus from blood clotting, it's crucial to understand how ginger interacts with medications for high blood pressure or diabetes. Ginger has natural properties that can change the way these vital drugs perform in your body. If you're taking medication to manage hypertension or control blood sugar levels, incorporating ginger into your diet could potentially lead to complications. It might lower your blood pressure more than desired or cause an unexpected drop in glucose levels. For those managing conditions like high blood pressure and diabetes, monitoring any changes is key when adding new supplements or foods like ginger. Always consult with a healthcare provider before making such additions to ensure they will not interfere with your prescribed regimen. Being underweight. For those who are underweight, ginger might not be the best choice. It's known to suppress appetite, which could make gaining weight even more challenging. Underweight people often have trouble consuming enough calories as it is, and when ginger steps in and potentially lowers their hunger levels, it can lead to further calorie deficits. Nutritionists can provide guidance tailored to individual needs regarding the use of ginger, while ensuring adequate nutrient intake and effective weight management strategies. Pregnancy. While managing your weight is crucial, the use of ginger takes on a whole new level of caution during pregnancy. Pregnant women often consider natural remedies to ease morning sickness, but high doses of ginger could be risky. Studies suggest that consuming large amounts results in an elevated risk of miscarriage, particularly within the first 3 months. Ginger's blood-thinning properties also present potential challenges for expectant mothers. If you're pregnant and contemplating adding ginger to your diet for its health benefits like easing menstrual cramps or stomach discomfort, it's wise to speak with your healthcare provider first. Low blood pressure. Ginger has active components like gingerol and zeramboan, known to expand blood vessels and lower blood pressure. This relaxing effect on the circulatory system can be a concern for those whose blood pressure tends to fall below the normal range. Using ginger could potentially cause their already low pressure to dip further, possibly leading to dizziness or fainting. If your health routine currently includes ginger supplements or you're considering adding them, it's crucial to monitor your blood pressure regularly. Surgery. Ginger consumption can notably increase bleeding risks during these surgical procedures because of its blood-thinning properties. It's wise for patients scheduled for any type of surgery to halt their ginger intake at least a week beforehand. This precaution helps ensure that there are no complications with anesthesia or other medications required during the process. Ginger's impact doesn't stop at blood clotting. It also affects blood sugar levels, which is especially pertinent for those with diabetes needing tight insulin control around an operation.